Assalamu alaikum respected doctors, welcome to my YouTube channel MBBS and BDS lectures. Today is the second video of repeat revision course of Periodontics, which is very important for NLE exam, MDS as well as for third year exam. Now in this second video we will discuss about gingiva and we will cover everything which are related to gingiva. Now, in this video, first we will discuss about zones of oral mucosa, then in which zone, from which zone gingiva belong. Second, we will discuss about parts of gingiva. Then we will discuss about epithelium of gingiva, and then types of epithelium, then each epithelium detail, then cells of gingiva. And I will also highlight the important point for MCQs in this lecture. First, gingiva. The oral mucosa consists of three zones. Mean we divide the oral mucosa into three zones. Number one, masticatory mucosa. Second, specialized mucosa. Third, lining mucosa or reflecting mucosa. First is the masticatory mucosa. Masticatory mucosa are the type of mucosa which are responsible for mastication, like gingiva is coming masticatory mucosa. Covering up the hard palate are coming masticatory mucosa. Now here the important point is from which type of mucosa gingiva belong, masticatory mucosa. This is MCQ's point. Now come to the second type, is a specialized mucosa. Why it is called specialized? Because this type of mucosa have a specialized structure which are not present in other parts of the body, like dorsum of the tongue, because dorsum of the tongue have taste buds, and second is the taste buds. Third is the lining mucosa or reflecting mucosa. Mean other than masticatory mucosa and specialized mucosa, the rest mucosa of the oral cavity is the lining mucosa, which line the oral cavity, or reflecting mucosa. Oral mucous membrane lining remaining parts of the oral cavity is the lining mucosa. In this lining mucosa, there is alveolar mucosa, which cover the alveolar bone, mucosa which cover the floor of the mouth, mucosa buccal mucosa which cover the cheeks, lips. Second, mucosa which cover the soft palate are the lining mucosa, and next is the vestibular fornix, mean vestibule. This is the lining mucosa. Now from this slide we gain a MCQ's point. Gingiva is belong from masticatory mucosa. Now come to the parts of gingiva. Anatomically, we divide the gingiva into three parts. Number one is the marginal gingiva, which are present around the margins of the tooth, means cemento-enamel junction area. Second is the attached gingiva, which are attached on the alveolar bone. Third is the interdental gingiva, which are present between two teeth. This is the interdental gingiva, which are pyramidal shape in interior region, mean interior teeth region, and cone shape in posterior teeth region. Now come to this diagram. The gingiva is divided into three: marginal gingiva, interdental papilla, and third is the attached gingiva. Now look at here. Attached gingiva are, why it called attached gingiva? Because attached gingiva are attached with the alveolar bone. Second is the marginal gingiva, which cover the margins of the tooth, means cemento-enamel junction area. Next is the in third type is the interdental papilla, which are present between two teeth. Now in interior region it is pyramidal shape, but in posterior region it is cone shape. It is cone shape. You can see here in this diagram. Now here again, in interior teeth, interdental papilla is the pyramid shape, but in posterior teeth, interdental papilla is a cone shape. Again, this is the MCQ point. Interdental papilla in interior region is a pyramid shape, and in posterior teeth it is cone shape. This is the MCQ point. Try to note these important points. Now come to the after types of gingiva. Now come to the gingival epithelium. Now, gingival epithelium is composed of overlying stratified squamous epithelium and underlying central core of connective tissue. Mean above in gingival epithelium, above is the stratified squamous epithelium and below is the in central core there is a connective tissue. Like in other types of epithelium, it may be gingival epithelium may be of three types. It may be keratinized, parakeratinized, or non-keratinized. Now come to the layers of epithelium. There are 4 layers of epithelium. Number 1 is the basal layer, or also known as stratum basal, which are present in the base, where there is a tall columnar cell. Second is the brachial cell layer or stratum spinosum, which have spindle-like cell. Secondly, third is the granular cell layer or stratum granulosum. And the fourth is the keratinized cell layer, which is the stratum corneum, which are present on the top. Now, what is the difference between orthokeratinization, parakeratinization, and non-keratinization? Now, the gingival epithelium may be orthokeratinized, parakeratinized, or non-keratinized. Now, the difference between orthokeratinization and parakeratinization and non-keratinization is that in non-keratinization, the two top layer is absent. Only the stratum basal layer is present and stratum spinosum. Stratum granulosum and stratum corneum is absent in the non-keratinization. Now come to the ortho and parakeratinization. In non-keratinization, only 2 layers present, and in keratinized, 4 layers present. But what is the difference between orthokeratinization and parakeratinization? In orthokeratinization, again, 4 layers are present. But in parakeratinization, 3 layers are present. Now in orthokeratinization, why orthokeratinization is different from keratinized layer? Because in keratinized layer, because in orthokeratinization, all 4 layers are present, but the superficial horny layer with no nuclei in the stratum corneum. There is no nucleus in stratum corneum in orthokeratinization, but all 4 layers are present. And well-defined stratum granulosum means the third layer is orthokeratinization is the well-defined. But in parakeratinization, the third layer is absent, which is stratum granulosum. But in superficial layer, means stratum corneum, is present and have pycnotic nuclei. In parakeratinization, stratum corneum retains pycnotic nuclei. Keratohyalin granules are dispersed, not giving rise to stratum granulosum. There is no stratum granulosum. This is the difference between orthokeratinization, parakeratinization, and non-keratinization. In non-keratinization, only there is no above two top layer, means stratum corneum and stratum granulosum. But in orthokeratinization, all layers are present. In parakeratinization, 3 layers present. In orthokeratinization, above layer have no nuclei, but in parakeratinization, above layer have pycnotic nuclei, but the third layer is absent. Now come to the gingival epithelium parts. There are three parts of gingival epithelium. Look at here. First is the, look at this diagram. In this diagram on the right side, where connective tissue are mentioned in the written form, this area show the tooth. And the red showing the epithelium. And the grayish color show the connective tissue. And the yellow color show the bone. Now the red epithelium which are mentioned as the oral epithelium are their type of epithelium which are keratinized and cover the attached gingiva and marginal gingiva. Mean the epithelium which cover the attached gingiva and marginal gingiva is known as oral epithelium, or also known as outer epithelium, and it is keratinized. Second is the sulcular epithelium, which are present in the gingival sulcus. Here in diagram, about E is the oral sulcular epithelium, which cover the gingival sulcus, and this epithelium is not attached to the tooth because it present in the sulcus. This is known as oral sulcular epithelium, and this is non-keratinized. And it may be keratinized in two conditions. We will, if bacteria is completely eliminated from sulcus, and one is another condition we will discuss further. Third is the junctional epithelium. In E region is the junctional epithelium from E to the below dot. This is the junctional epithelium, and junctional epithelium attach the gingiva to the tooth. This is a junctional epithelium. These are the types of epithelium. Now, the gingival epithelium parts. First is the outer or oral epithelium. Oral epithelium or outer epithelium which is keratinized, and this is keratinized, and extend from mucogingival junction to the gingival margin. Mean from mucogingival junction where our gingiva and cheek mucosa mean in sulcus meet. This is mucogingival junction. From this is the mucogingival junction. Look at this diagram. Mucogingival junction in below diagram on the left side, there is a mucogingival junction where our mucosa and gingiva meet. This extend from mucogingival junction to the gingival margin. Mean it extends from attached and free gingiva. Second is the sulcular epithelium. Sulcular epithelium faces the tooth without being in contact with the tooth surface. It faces toward the tooth but is not contact with the tooth surface. The third is a junctional epithelium. Lie about at the base of the gingival crevice, mean gingival sulcus. Gingival crevice present at the base of the gingival crevice, mean gingival sulcus base here, and provide the contact between the gingival and the tooth. Mean between gingiva and tooth, it provides the contact attachment. When this attachment lost and moved toward apical region, then there will be deepening of the sulcus, which is known as pocket. Now these three epithelium are very, very important. In next slides I will show the detail here. First is the oral epithelium. Its thickness is very important for MCQ's point. Its thickness, oral epithelium thickness is from 0.2 to 0.3 mm, and it is mainly parakeratinized. And keratin K1, it is type of keratin. Keratin K1, keratin K2, and K10 and K12 are present. K6 and K16 indicate highly proliferative epithelium. If there is a highly proliferative epithelium, mean oral epithelium, there is a highly proliferative epithelium, there will be K6 and K16 type of keratin. K5 and K14 stratification specific cytokeratins are also present. Parakeratinized area express keratin type 19, meaning in parakeratinized, actually it is a mainly parakeratinized, and parakeratinized area express keratin type 19. Now the important thing is its thickness, and it is keratinized in parakeratinized and parakeratinized area express keratin 19 type, and when keratin 6 and K16 present, it indicate highly proliferative epithelium. Second type is the oral sulcular epithelium. Why sulcular? Because sulcus. Sulcular epithelium are non-keratinized, and junctional epithelium is also non-keratinized. Sulcular epithelium lack granulosum and corneum layer because it is non-keratinized, have only 2 layers. And K1, K2 and K10 and K12 cytokeratins are present. It contains K4 and K13 so-called esophageal type keratins. Remember, esophageal type keratin, which is K4 and K13, are present in the sulcular epithelium. Again, MCQ spot. And sulcular epithelium is non-keratinized. Again, MCQ spot. It also expresses K19 and normally does not contain merkel cell. This is again important point. Normally in sulcular epithelium there is no merkel cell. We will discuss further. Now the sulcular epithelium has the potential to keratinize if sulcular epithelium are mainly non-keratinized, but have potential to keratinize in 2 conditions. Number 1, if it is reflected and exposed to the oral cavity. If it is exposed to the oral cavity, like in pocket. Second, if the bacterial flora of sulcus is completely eliminated. Again, in these 2 conditions, these are important MCQs point. Now come to the junctional epithelium. This is a junctional epithelium. Now, junctional epithelium, again, it is stratified squamous non-keratinized epithelium, non-keratinized, like circular epithelium, and this is the important part, it is also non-keratinized, and it is 3 to 4 layer thick in early life, but number of layer increase with age to 10 or even 20 layers. Mean in early life it have 3 to 4 layer thick, and in late age, when age increase, it become 10 or even 20 layers thick. Remember, this is MCQ point. Next, it taper apically, mean when we move from crown to the root, it taper mean become narrow, with 10 to 29 cells wide coronally, mean toward the crown of the tooth, and 1 to 2 cells apically. Now, these cells are grouped into 2 layers. These cells are grouped into 2 layers because it is not stratified. Again, 2 layers. The basal layer facing the connective tissue, and suprabasal mean above the base layer extending to the tooth surface. Its length, this is again very important. In junctional epithelium, the length range from 0.25 to 1.35 mm. Now in junctional epithelium, the things are important is its layer, its non-keratinized, and its length. Now come to the renewal of gingival epithelium or turnover, mean it's remodeling, its turnover, renewal, again become new. Now the mitotic activity exhibit a 24-hour periodicity, mean in 24 hour our gingival epithelium become renew, mean old is replaced with a new, with the highest and lowest occurring in the highest in the morning. In morning the gingival epithelium renewal is highest, and in evening it is lowest. Again MCQ point. Now in the renewal of gingival epithelium, 24 hour is important, and in morning highest renewal and in evening lowest, and turnover time are very important. Per gingiva it is 10 to 20 days, mean 2 weeks, and per junctional epithelium it is only 1 week, mean 1 to 6 days. Mean the turnover of junctional epithelium is very rapid, only 1 week, and the gingiva turnover is 2 weeks, mean 10 to 20 days. This is all important points for MCQs in the epithelium. Now come to the cells of epithelium. Again, these are important. The cells of epithelium, we divide the cells of gingival epithelium into two types: keratinocyte and non-keratinocyte. Keratinocyte are present 90% present in the gingival epithelium, mean the most abundant cell types. The MCQs come, the most abundant cell types of gingival epithelium is the keratinocyte, which is 90%, and other rest is the 10% is a non-keratinocyte. Now, cells of epithelium. In addition to the keratin producing cell, which comprises about 90% of the total cell population of the oral epithelium, contain the following types of cell. Now, two types of cell: keratinocyte and non-keratinocyte. In non-keratinocyte, there is the clear cells, melanocyte, Langerhans cell, Merkel cell, and inflammatory cells. Now, first, clear cells. Clear cell, why it is called clear cell? Because it has no keratin. And clear cell type are often stellate, means star shape, and have cytoplasmic extension. Therefore, it becomes star shape because it has cytoplasmic extension of various size and appearance. Second is a melanocyte. Melanocytes are responsible to produce melanin, mean our gingiva color is due to melanin. Are dendritic cell present in the basal and spinal layer, mean stratum basal and stratum spinosum layer present. Remember, this is MCQ point where melanocytes are present in below two layer. Next is the Langerhans cell. These are immune cell. This provide immunity for the gingival epithelium. Langerhans cell are dendritic cell located among keratinocyte at all suprabasal level, mean located among keratinocyte. They are restricted to the zone of orthokeratinization. Again, this is important. They have potential to present antigen to T lymphocyte and activate them, hence have an important role in immune reaction. Meaning gingiva, the Langerhans cell are responsible for immune reaction because it stimulates T lymphocyte, and these are present, Langerhans cells are present in the between keratinocyte, and they are restricted to the zone of orthokeratinization. They contain, again MCQ's point, they contain G-specific granule which is known as Burbeck's granule. Burbeck's granule are present in the Langerhans cell and have marked adenosine triphosphate activity, mean have marked ATP, adenosine triphosphate activity. Now come to the last cell type, which is the Merkel cell. And in physiology, we already discussed there are two types of receptor. One is free nerve ending, and second is the separate cell. But Merkel cell is the separate cell which acts as a tactile receptor. Merkel cell are located in the deep layer of the epithelium. Remember, in all these cells, clear cell, melanocyte, and Merkel cell are present in the deep layer. Only Langerhans cell are present in the above layer. Why? Because from above bacteria attack, it will stimulate the T lymphocyte to kill these bacteria. Now, Merkel cell are located in the deep layer of the epithelium. They harbor nerve ending and are connected to adjacent cell by desmosome. They have been identified as a tactile receptor. These are the tactile receptor. This is all about gingiva, and these are all important MCQs point. If you watch this video and go to the MCQs book and attempt your MCQs, there is no need for you to study from any book. Now, today our topic is finished. If you like my video, press the like button and share this video with your friends. If you are new to my channel, subscribe my channel by pressing the red subscribe button, and also press the bell icon in order to receive my each new video notification. For watching my videos, I am very thankful to you. Thank you very much.